So we'd like to have a couple words. As you know, we are here at The Cure, and this is a wonderful facility that we have their CEO that will come now and join us to just tell us a little bit about The Cure and what they do here. Thank you, Seema, for you coming. Yes.
Hi, everybody. Hello. Hi. Welcome. Hi. So good afternoon, everyone. It's a real privilege to welcome you all here to CURE and to UN General Assembly's Science Summit, and especially during a day that we are discussing a topic that is near and dear to my personal passion, as well as a key priority for CURE as well, and that is women's health. So I don't know how many of you know what CURE is. CURE, we call ourselves an innovation campus. This is a research and development as well as a business facility. And in this building, while you may not have exposure to it, and you're probably coming from the lobby to the second floor and back, in this building are 25 different companies that call themselves part of the CURE ecosystem. They call CURE home. Companies that are working on gene therapies for Alzheimer's disease. There's a women's health company that is working on a synthetic breast milk protein. There's a company that is working on the first floor on exoskeletons to rehabilitate people who are wheelchair bound, people who have cerebral palsy or other neural defects. There's also a discovery and drug development and so-called Lab of the Future supported by the Empire State, which is a New York state, that's focusing on AI-assisted chemistry for de novo drug design, and many other companies that call CURE home. So I just wanted to make sure that right here on Park Avenue South and in this particular building, the people in this building are working on cures every day, because our mission is really simple: advancing innovation, healthcare innovation, and finding cure. How do we do that? We do that through entrepreneurs. We believe in the real power of entrepreneurship to actually do something that incumbent large institutions cannot do, and that is to look beyond the today and to the future and invent new things. And so how do we support entrepreneurs? We support them through multiple things, including space, research facilities, but also through education, exposure to investors, video courses that we do, conferences like this, etc. Just a couple of words about women's health. So last year, soon after the McKinsey report came out and many other reports came out about the health of women, we looked at actually what is it that investors look for, because we are a sister company of Deerfield, which is the largest investor. So why is it that investors are not yet investing in the health of women? And we issued a benchmark report that we actually celebrated some of the ARPA-H winners of the ARPA-H grant for women's health right here upstairs in the rooftop in December. And based on those insights and what we learned looking at and interviewing investors, we came up with a conference called The Power of X, which we held in March. And what was clear was a few things that I will just summarize and then I'll close, which is, there were three key pillars. One was evidence and equity, right? We can't fix what we don't measure. And so measurement and the knowledge gap and the data gap have been a big thing that have put us back in terms of health of women. And what investors are looking for, what we saw through their eyes, is really the ability to close the data gaps and design with women at the center. And so that is one key thing, priority, that I think that we discovered and identified and are helping to move forward. Second is access and affordability, and that is innovation only matters if it reaches the people who need them, and otherwise it actually is just main innovation. And so how do we build models that reduce friction in pricing, delivery, trust, etc.? And the last thing, which I believe is sort of at the center of everything that we do, in all the key therapeutic areas and in many other things that we get engaged in, is the speed to translation. And that is, how do you take something from bench to bedside, and how do you ensure that the concept to clinic happens by pairing founders with people who have access to capital and the regulatory know-how. And so we do this by our video courses for entrepreneurs who are members in our ecosystem. We do this by expanding our digital community, creating accelerators that help entrepreneurs push their ideas forward. And my final thing that I'll mention is that this November, we have the X Factor conference where we are bringing entrepreneurs with investors, industry, academia, as well as people who are from the government to really push forward this notion of translational research, especially at a time when funding seems to be contracting. NIH funding is going away. So private equity, other sources of financing needs to be identified, not only in the area of women's health, but also in the area of other important priorities. And so our goal is simple: to shorten the path from idea to impact, and on the women's health arena, to really figure out a way that we can push this field forward with everybody else who is in this. So I just wanted to say a few words. Happy to see many, many, many familiar faces here. And I had no idea, Shirley, I was going to run into you of all people this morning when I walked in. Good to see you, and hope you're doing well at AAAS. Yes, great to see you as well. So with that, I will just end by saying that enjoy yourselves, and be sure, because next year again, we're going to be holding the Power of X conference, which is health of women, and many of you were part of that. And thank you so much for listening, and thank you for being here at CURE.